Good evening and welcome to High Country Doula's How to Build Your Birthing Team. Tonight we're going to share some insights of what are your choices when it comes to planning out your birth and your pregnancy, and who would you like to support you along the way. If we have not met before, my name is Allison Rollins. I am a co-owner of High Country Doulas. I am a labor and postpartum doula, as well as a infant feeding specialist. I love to support moms and their partners in understanding what their choices are and helping them decide what's the right course for them, just by delivering them with the right information that they need. So we really like to focus on evidence-based research and resources for our families, because we know that's the best route for them to be able to get quality information when it comes to making those choices. And High Country Doulas loves to work with providers and nurses in birthing facilities across Western North Carolina, Northeast Tennessee, and into Virginia. We really love to help support families. We have a wonderful team of doulas, and we're here for you to answer your questions or connect you with the resources that you need. We can give you insights from our experience, many years working with families in these different birthing facilities. And tonight we're going to share with you a little bit more about that so that you can prepare for your upcoming birth and feel like you have the people that you need around you to have the experience that you really would like. So I've shared a little bit about myself. I would love to just talk a little bit about who is present and who along the way in your pregnancy can support you to have a happier and healthier pregnancy. We're going to start tonight by talking a little bit about your providers. So let's go ahead and get started. I hope that you will share our video, check out our other videos and webinars on Facebook and YouTube. So welcome. Glad you're here tonight. Pregnancy is really such a delicate and beautiful adventure. And really, I really am passionate about what I do as a doula, supporting families, helping them to make the right choices. One of the first choices that you will make will be your medical provider. There are really some important components of your birthing team. Today, we are going to talk about medical doctors, midwives, and doulas. I also will touch on nurses, because you will spend a lot of time in your birthing facility supported by nurses and staff within that facility. So we're going to talk a little bit more about that. You, or maybe your primary care doctor, is often sort of the first person to reveal that you're pregnant. So a lot of us are going to be taking in-home pregnancy tests. We may be working with someone if we're dealing with fertility issues. So your first point of contact will be that medical provider that you see, whether that's your family physician or your obstetrician or midwife. You're really then be able to begin sort of the process of building your birth team. So that's your first step. Researching all your options, the facilities, the people that you want to support you, your main provider. A general practitioner really can be an incredible source of knowledge on community resources, referrals, and also local health services. It's really crucial for you to kind of develop a relationship with a family physician if you don't already have a primary care provider, such as a family physician, nurse practitioner, that you have the confidence of working with you as you begin this journey. They can be really key with support if you need treatment after your care with your obstetrician or midwife has ended. So throughout the time that we're going to spend here today, we are going to go over different options for you to have the most supportive team for you and your personal needs. OBGYN. It's really an acronym for obstetrician gynecologist. This is a doctor who really specializes in overall women's health. OBGYNs are trained in a wide variety of general health services similar to your primary care doctor, but their focus is medical. The focus of the medical care is specifically on the female reproductive system. They provide routine medical and preventative screenings, perform surgery, and assist with labor and delivery. Some of these have private practices. However, often now they're mostly in a group, a larger medical practice. And if you choose an OBGYN practice, you most of them are going to rotate their on-call schedule. So you will get to know each of them throughout your prenatal period and your prenatal visits. And then you will have that provider that is on call in the time that you go into labor. To become an OBGYN, one must complete a bachelor's degree, 4 years of medical school, and then 4 years of graduate level education, such as a residency focusing specifically on obstetrician and gynecology. Many choose to continue their education for following 3 more years in order to specialize in a specific field as well. So typically an obstetrician gynecologist has had an incredible amount of training, and some of those obstetrician and gynecologists have even further training. So obstetrics obstetrics is really a subdiscipline of internal medicine, and that is related to the medical care specifically before, during, and after a woman gives birth. Obstetrics focuses mainly on a woman's overall health during the experience of pregnancy, labor, and childbirth. They are highly trained and are typically going to be the ones, if you have any high risk, they're going to be the ones that you are going to have as your medical provider. So gynecology is part of that, and you may have a couple gynecologists who specifically specialize in this that work within your medical practice that you go to. It is a branch that focuses specifically on reproductive health, that does screening, diagnostics, treatment, and care for the health of the vagina, uterus, fallopian tubes, and breast. This field is really, a lot of gynecologists do well visits for moms. So you would typically see a gynecologist not when you're having a baby, but before or after. With obstetrics and gynecology, they also specialize, have specialized knowledge and professional capabilities, and they're able to prescribe. They're also able to treat and assist in the birth. They can really be a huge asset. I know a lot of wonderful OBs who just really make it a point to help women and their partners understand what's going on when things don't go as planned or normal, either in pregnancy or in birth. And they really take the time to explain what's going on. It can be a scary time when you're going through something like that, an unexpected time. So really, if you want the specialized care of an obstetrician, you really want to ask around and possibly visit some of these to see if you really connect. I think the biggest thing about choosing your medical provider is really making a connection with them. Sometimes it's taking time to visit their practice and see how their office is run. Also, talking to other people who've experienced care and support there can be really helpful. But you can't take all of that advice because you may not have different goals than your friend who shares her journey with you. Okay. There are a few things really to consider when deciding whether you want a medical doctor or a midwife. So, both are really going to be assisting you throughout your pregnancy and birth, and they both will support you in similar ways. A midwife is a little bit different in that she's not going to do any high risk. She typically is going to focus on um, very low risk pregnancies. But we're going to talk a little bit more about that difference between a medical doctor and a midwife. So typically, a medical doctor is only going to support you in a hospital setting where you may find midwifery care in both a hospital setting as well as a birthing center setting, and potentially a home birth setting, depending on the state that you live in. Both Virginia and Tennessee are states that do allow home birth by midwives. So if that's a choice that you want to make, that might be right for you, it's always, always important to spend that time meeting with the provider and really making that connection. Midwives do tend to offer somewhat of a more holistic approach, and they are um, typically, when clients want a more natural, unmedicated childbirth, midwives do tend to have more clients who are that, and they're very centered not only on what the goals of that mom is who may want to avoid other interventions, but she may sit with you and spend more time with you navigating that, typically. So it's a good thing to find out. Every practice and provider is going to be a little bit different. So take that time that you need. When we're talking about risk, obstetricians are trained to manage high-risk pregnancies and to be able to perform surgeries, whereas midwives cannot. They are also able to use tools to facilitate delivery, such as forceps and vacuums. Midwives, again, are not legally allowed to do so. However, midwives are experts in low-risk pregnancies and are trained to provide care with little intervention unless otherwise specified. One thing to note is that a lot of midwives, certified nurse midwives who work alongside obstetricians, typically have the backup of those obstetricians. So if you're working with a midwife and you had a really smooth pregnancy and no complications and you're low risk, and something does arise during your delivery or your labor, then they're going to have the support typically of an obstetrician in that medical practice who's going to come in and support you in that transition. So that's one good thing to consider if that is a concern for you. So obstetricians are licensed and highly regulated in the United States, and licensure and regulation of midwifery does depend on the type of midwife and the state. So if you need to know more about that, it's good to check that on your specific state. So let's talk a little bit more about what is a midwife. I think a lot of people mistake a midwife for a doula. When I tell people I'm a doula, they say, "Oh, you're a midwife." And I'm like, no, 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 I'm not a midwife. I don't do anything medical. That is not my role. So midwives are going to be highly medically trained to help assist you with all aspects of pregnancy, prenatal care, delivery, and then women's health care as well. Some women choose to use midwives as their primary gynecological support and care as well. So one thing to note, according to Sarita Bennett, who is a DO and CPM, she is also Vice President of the Midwives Alliance in North America, says, in the midwifery model, it is more of a shared decision-making model with the provider educating and supporting, while a client has the ultimate control over what happens to her and her baby. Compared to an OBGYN, midwives are often able to allocate more personal time with the patient. So without pulling away from other patients, the physical, emotional, and social needs of the patient are addressed, and the goal of providing a satisfying birth experience really remains priority. So this is typically what we've seen with midwives in the past, that they've had more time to spend at prenatals and things, but somewhat that is changing in practices that have midwives and obstetrician. You may find that you're not getting as much time with them. So it's not all over the place that you can expect that. So it's really good to ask around and kind of ask, like, how much time do you have in prenatal to visit and spend with me and answer my questions? And prenatals are one of those things where sometimes you really don't have any questions and it's short, which is nice because you can get in and out if you've got to get back to work. But it is good to know, depending on who you are and what kind of support you're looking for, it's really good to ask those types of questions. So in the midwives model of care, this is sort of a comprehensive definition composed by the representatives of what's called the Midwives Alliance of North America, or AMANA, and the North American Registry of Midwives, or NARM, the Midwife Education Accreditation Council, or MEAC, and the Citizens for Midwifery, or CFM. They have a consistent and relevant explanation for those practicing, so any woman who is practicing as a midwife. It does include monitoring the physical and the psychological, as well as the social well-being of the mother throughout the childbearing cycle, and providing the mother with individualized education, counseling, prenatal care, continuous hands-on assistance during labor, delivery, and postpartum support, minimizing technological interventions, and identifying and referring women who require obstetrical attention. So this is the specific midwifery model of care by these midwifery organizations. If you want to learn more, you can go to cfmidwifery.org and find out more about this midwifery model of care. Now, this is a goal from this model, but it may not be how your midwife is able to practice. So it's a good questions to ask. All right, so let's talk more specifically about the types of midwives that there are practicing in your area, or could be practicing in your area. The first one includes a certified nurse midwife, and these are registered nurses who have also received graduate level nursing midwife degrees. Their training is combined with obstetrics, gynecology, and midwifery, and they are also required to pass an exam administered by American Midwifery Certification Board. Some of these certified midwives are also family practitioners as well, not family practitioners, FNPs. Another type of midwife is the certified midwife, or CM. CMS have also completed a graduate level midwifery degree and passed American Midwifery Certified Board exam. The next type is a professional midwife, and these are identified as CPM. We do have these in Virginia and Tennessee that do support women with home birth. CPMs have met the certification requirements laid out by the North American Registry of Midwives and is qualified to provide midwifery's model of care. This type of midwife is the only credential that requires knowledge and experience of out-of-hospital birth settings. So a CPM is trained in out-of-hospital birth settings. Another type of midwife is called the direct entry midwife, or DEM. And a DEM can be a CNM, a CM, or a CPM. This label does describe midwives who specialize in home and birth center births specifically. Lay midwifery do not have any formal education or training, but have apprenticed and gone through extensive hands-on training and to offer sort of a form of apprenticeship or self-study. So these are specifically different types of midwives. You may or may not have all of these specific types in your area. So let's talk about what are the benefits of having a midwife as a part of the birthing team. There are really many reasons to choose a midwife. Or many reasons that women choose to have a midwife. According to American College of Nurse Midwives, some of the benefits of having midwifery care can be reduced rates in labor induction and augmentation, reduced use of regional anesthesia, decreased risk of preterm birth, decreased risk of infant mortality rates, decreased risk of need of a C-section, decreased third and fourth degree perineal tears, increased satisfaction with quality of care. Additionally, mothers who have chosen to include midwives in their birthing team report reduced maternity cost, longer prenatal care visits, undivided attention, more freedom in the choices associated with their birthing experience. So as always, I want you to take everything, all this information with a grain of salt, specifically because midwives get to support women who are low risk versus high risk moms who do have to be supported by obstetrics and gynecologists. So thinking about that, the options for those women to be able to have the support of midwife are really not there if they have high risk. All right, so midwife versus doula. I was talking about this earlier because I always get asked like, "Oh, you're like a midwife," and I'm like, always tell them, no. I love midwives, but I'm not a midwife. Midwives and doulas are both incredible additions, right, to your birthing team, but our roles are very different. And a midwife is really trained to provide that independent care in a medical practice setting for all the stages of pregnancy and the birthing process to both you and your baby. A doula takes sort of a non-medical supporting role as a source of comfort and assistance and resources. So we offer a lot of educational resources, very much there to listen, help you know what your choices are. We're going to discuss a little bit more about what it is that doulas provide. I love being a doula, so I love sharing about what I do. So you may have heard this before, but the Greek translation of doula is a woman who serves. And given their role in such a really life-changing event such as birth, serving is really, truly what we do. We are there at your feet with you, supporting you with massage, holding your hand, being a shoulder to cry on, helping you understand what your choices are. We are there as labor companions to you and your partners, labor support specialists. Sometimes we're called birth assistants. And we do all of that emotional and physical and educational support to expecting and laboring and postpartum mothers and families. We are highly trained professionals, but we are not medical caregivers, and we do not have the ability to give medications or make any medical decisions. Having a doula really to be part of your birthing team can increase your confidence, knowing that you have someone who's going to be there. You may not know which provider is going to be with you, but you can specifically know who will be on that team with you throughout your laboring experience, alongside you and your partner or whoever else is going to be a family or friend with you. So let me talk a little bit more about what we do. I often have conversations with couples who are interested in doula support, but they're not really sure what it is that we do. So we really try to attune and establish a relationship and connect with really what your goals are. We really take an active role in helping provide you with information. We teach classes. We send evidence based resources so that you can make the decisions that you need to. We listen when you need somebody to listen. Um, we reflect with you. We often give feedback on birthing plans because we're very familiar with what policies are of the different birthing facilities in the area. And we help kind of support you and your partner's fears and concerns. We help you understand what to expect and help you kind of navigate what your preferences might be. I know I often ask women, like, so what do you imagine when you imagine the birth of your baby? And so it's really hard, I think, especially for first time expectant couples, to really know what that is. The unknown can be really challenging. And if you are somebody who really likes to read or just consume information, that can be really helpful, but it can also be overwhelming because there's lots of conflicting stuff out there. And so deciding what it is that, like, what sounds good to you and what is that really going to look like? So we really try to help you unfold and tell the story of what that really looks like. And oftentimes we give it to you in two different scenarios because every woman's going to experience things differently, even if they have similar journeys. So we are here essentially as your guide, often to ask questions, receive those resources, help you seek support. We refer you to different providers and practitioners in your area when you need that support. And doulas really are there to make themselves available to you 24/7. So if you wake up in the middle of the night having some contractions and you're not sure if those are Braxton Hicks contractions or really actually labor, you call us. It may be 4 a.m. I got a call last night at 4 a.m. So that is normal for us. We want to be there when um, you need that other person, and that is what we provide to you. We are on call for you. We stay with you during your labor and throughout your birth. We help guide partners, and we'll talk a little bit about that in a minute. We are really in constant close proximity. Um, when you need us, when you need us to be right there with you, if you need our hands of massage and support and comfort, we're there. Or we're off just sitting there if you need us to sit with you. So we do that for both you and your partner and help you kind of navigate what are your options and what can you do to help relax. What can you do to get through the different surges that you're going to feel during your labor? And every woman experiences that differently. So some of the things that we do, we help women with breathing techniques that might be helpful for them. We help you with positions for labor and birth. We also help you with touch techniques. We help you with visualization. We help you if you're working with um, doing hypnosis techniques such as hypnobabies or hypnobirthing. We can help make sure that you have what you need to navigate that. Visualization, setting up your space and your scene, assisting in just creating that calm environment for both you and your husband, reassuring you. And after birth, many doulas will really help aid in helping you get cleaned up. We'll help you with your physical recovery. Breastfeeding is a big part of that. If you're planning on breastfeeding, we help you make sure that you have that good first breastfeeding experience. We support family bonding, so ensuring that you guys have time to have that first couple hours of bonding and any basic newborn care. So, in addition to helping support women through pregnancy and labor and birth, we do support women in the postpartum period, or that what we call the fourth trimester. And postpartum doulas are trained to specifically help you understand what recovery looks like for you and help you navigate what's going to happen and what to expect with feeding your baby, sleep, taking care of your baby, understanding your baby, and reading your baby's cues. We also can help with just light housekeeping if the dishes need to be done. You know, whatever it is that you need to make you feel make it through that day is what we do. We also love to help dads know how to take care of babies too. So we teach newborn care to both parents. We also can help with sleep. So oftentimes I get moms who are like, can you help me to navigate a good, healthy sleep routine for my baby? So as a postpartum doula, I can come in and help um, stay with you overnight to help your baby in that transition from going to sleep and getting support for feedings at night, or whether that's bottle feeding or breastfeeding, and helping baby to settle, making sure baby is as comforted and cozy as possible to be able to get that best, really regenerative sleep that I call it for those nighttime. And that if baby's sleeping well, we also know that mom and dad are sleeping well. So we work with families sometimes just for 1 or 2 visits, and sometimes we work um, for weekly visits. So we do weeks of visits for moms who really need that hands-on care. We also do twins. So if you're expecting multiples, we will work with you to help you be able to support twins and get more sleep at night, help you to learn how to tandem feed and how to support 2 babies at once so that you'll have a little bit of time in between that. It can be super challenging, but we want to take some of that stress and weight off of you so that you can get the best recovery as possible. It's really important to establish your own individual needs as a family and to kind of get you matched with the right doula for you. While there's, oops, too many. While there's really not any one formal degree program or universal recognized credentialing for doulas, there are many trusted certifications that doulas can choose to obtain. Typically, a birth or labor doula must finish about 7 to 12 hours of childbirth education, about 16 to 20 hours of doula training, and attend several births prior to their certification. Additionally, those who plan to provide postpartum services will usually attend about 27 hours of postpartum doula education and assist several women with their postpartum doula support prior to certification. Doula certification is available through different doula training programs and childbirth education organizations, which could include Pro Doula, DONA International, Birth Arts International, and Childbirth International. I have several different trainings from several different organizations because I am a lifelong learner, and we really all of our doulas at High Country Doulas are trained through Pro Doula, and some of them are trained through other organizations as well. Many studies really have demonstrated the benefits of doulas being present during labor. And this is really important to know, just how women's experiences are and how they feel about their experiences and the actual outcomes for maternal health and infant health. There's sort of a common theme of positive birth outcomes as a result of all this research. So women are really less likely with doula support to need pain relief medication, such as synthetic oxytocin like Pitocin. This is decreased by 40%. and requests for epidurals have lessened by 60% with the support of a doula. Other studies have shown that having a doula as a part of the birthing team decreased the likelihood of an unexpected cesarean by 28% and the length of labor by 25%. So who doesn't want to have a little bit of a shorter labor sometimes? That can be really helpful. Though in retrospect, fast labors are super intense, like a freight train running. So I don't wish that on any of you either. Throughout these studies, really the best results occurred when the expecting mother received continuous labor support from a doula rather than a staff member of the hospital or somebody from their personal lives previously. And I think what this notes is that there's built a connection between a specifically trained doula and knowing that she doesn't have an agenda for you or a philosophy. Her goal really are your goals. Her goals are understanding what your goals are and then helping you navigate if any of those jump off the rails or jump off the tracks and you have different choices that you need to make. She's going to help present you and make sure you understand those choices. She's going to help support the other people in the room. So our team members are often work collaboratively with nurses, help support them, make sure that they are able to do their job. We never get in the way of medical providers doing their job. We also really want to ensure that everybody in the room kind of knows what your goals are, whether that's through a birth plan or just checking back in with you and your partner or husband to say, hey, did you guys still want this? So oftentimes our role in the room is really to be there and be present, but never be in the way. Be a part of that. And we often are able to know what your needs are before you need them. That's our goal. If I can identify what's going to be your need in the next 5 minutes, then I'm going to plan on that and I'm going to shift for you. I'm going to help you make that shift. So if you're interested in the doulas and the doula support, a great way to do that is to get a consultation. So you can meet with the doula and sit with them, hear about why they love doing what they do and how they can really help you have the experience that you want to have, a nice supported positive birth experience. In addition to supporting mom, I often note we are there for dads too and partners. Doulas do not take the place of your partner. Instead, we provide tools and also reassure partners to encourage their participation. We help them know that that's normal, especially partners have a hard time when they see you in pain and so intense, especially on that first birthing experience. They have never, ever witnessed anything like that. And they really need that reassurance that she's having some really great strong contractions and her labor pattern is really beautiful. Here's what you can do. If you want to push right here, that's really going to help her. Or, could you grab her water? She might really love a drink of water. So we're really there to help dad be in that circle right with mom. Navigating that journey together is really what we want to see. I have worked with a lot of dads who really want hands-on, and if dads are ready to get in there and be really present, I swear exactly where I put them. I will note that there are dads who just I just want to make sure she's covered. If you've got her, then I'm good. And I want to check in every little bit, but I'm going to kind of hang out, over here, or I'm going to sit over here. So everybody's different, right? And so we just need to let you be however you want to be if you're a dad. Dads really know partners. And so as a doula, I'm really often saying, you know her best, when she's, when she needs something, when she's got that look in her eye. So we really work as a team, and it's a really beautiful thing. One of the best ways to ensure a positive birth experience is really to have all the people you trust that will meet your physical, your emotional, and your informational needs. A personal partner, this may be your spouse, your life partner, your best friend, or a close family member. We often have couples who want their parents, moms, dads, to be a part of that birthing team. And so we talk about that. We bring those people into prenatals to help them understand what our role is and to help them know what they can do to help support in that thing. I think it's really exciting to be included in that journey if they're wanting to be supportive rather than just being an observer. So on occasion, I have been in births where they do kick people out of a room. So that can happen. But on a whole, many birthing facilities will let you have several people supporting you if they're there in a positive way. I have seen a lot of some L&D nurses kick out people who weren't very helpful. So they do not have any qualms about doing that. And I would challenge you to ask those questions. Are these people going to help me stay positive during this really challenging time where I'm going to be needing to focus on the work of labor? I'm going to be, my emotions may be up and down. Is that person that I'm inviting to my birth going to be able to handle that and see me go through that and maintain positive? So just those are good questions to ask yourself. So lots of extreme emotions of joy and love and excitement are truly expected when it comes to birth. All right, so I'd already talked about asking yourself questions, really reflecting on what your priorities are for your birthing experience, have sort of some clear expectations and recognize your individual needs, helping you to immerse, helps you really, helps you when you're trying to create that dream team that you're looking for. And these questions that can be helpful to ask yourself are, if you haven't already decided, where would you like to have your baby? What birthing facility? Who do you intend to using medical intervention? Is that something? Do you want to have an epidural? Do you want to have gas? Do you want to have narcotics? What are your plans for pain management? Do you want a tub? Do you want to have a doula? Do you want to try hypnobirthing? What are you going to, what time, energy, and investment are you going to make in those things? Is a vaginal birth your priority? Do you want your caregiver with you during your labor? Do you want or need additional support beyond delivery? And are you considered high risk? So just most importantly, follow your own intuition. You can usually won't go wrong. You know what's best for you. A woman in birth is at once her most powerful and her most vulnerable. But any woman who has birthed understand that we are stronger than we know. Marcy Macari. Thank you for taking the time to walk through our presentation on how to build your birthing team. I truly love sharing important information with women and men who are eager to learn and teach other people about what your choices are and understanding that journey into parenthood. If you have any other questions, please email us at info@highcountrydoulas.com. We are always, always here to support you. I had an incredible time sharing with you tonight. If you feel like you need support on this journey, we are here. Give us a call or email us. We'd love to schedule a consultation with you. I hope that this webinar has been helpful for you and you feel like you're equipped to be able to understand what your choices are and get that birthing team built that you really um, can meet all your needs. All right, good night.